steroids because they are your anti-inflammatory medications. So, let's discuss your medications for your hyperthyroidism. Okay. Mamaya na pala. Nasa susunod na slide. But, let's talk about your thyroidectomy first. I did mention that. When you're going to remove your thyroid gland, you are subjecting the patient to also losing your parathyroid hormones. And if you can remember our discussion in your fluid and electrolytes, your parathyroid hormone is responsible for your calcium regulation. Okay, and the release of your calcium into your system, right? So, if in any case the patient has the removal or total thyroidectomy, that would include that the patient might also have the removal of your parathyroid gland. And post-operatively, it is important for us nurses to check if the patient might also be suffering from your hypocalcemia. And if you can again remember, in NCM 112, I have mentioned that with your hypocalcemia, you have several manifestations, and one of which would be your Bostic sign and your Trousseau sign. Okay, Bostic is your twitching of your ipsilateral part of your face when it is going to be tapped or there is a stimulus there. And your Trousseau sign, naalala ninyo, pinadrawing ko pa ito sa inyo. Your Trousseau sign is your carpopedal pulses or spasms when you have your inflation of your BP apparatus. Okay? It's basically going to happen in the whole of your hand until your wrist, that part. So that is your Trousseau sign. And they are manifestations of your hypocalcemia. Not only that, when you have hypocalcemia, you are also, the patient is also anticipated or expected to be suffering from your twitchiness of your extremities. There is your spasm. And in worst case scenario, the patient might also be suffering from your tetanic seizures. So maraming mangyayari dyan kapag hypocalcemia. And again, this is because there might be an accidental removal or your trauma on your parathyroid glands. As a result of that, thyroidectomy or your surgical interventions. Okay, so what can we do if in any case the patient might be suffering from tetany? For tetany, ang gamot mo na ibibigay dyan, because with your tetany, you have your hypocalcemia, ang gamot na ibibigay mo should be something that would correct your hypocalcemia. And that's going to be your calcium gluconate or your calcium chloride. Okay, this is applicable for your tetany or your hypocalcemia secondary to your thyroidectomy. Okay? Next. So, client education on your radioactive therapy. I've mentioned that you have your surgery, diba? Natapos na tayong mag-discuss doon. Now, let's go to your radioactive therapy. Okay, kasi kulang sila ng iodine. Okay, so you also need to provide something to your client. So with your radioactive therapy, it also tries to correct the abnormalities that is happening in your thyroid gland. So think brachytherapy. Similar to what is being done in your oncologic nursing or your cancer nursing. So, client is mildly radioactive and should follow radiation precaution usually for 7 days. So, kapag nakainom ng pasyente mo ng radioactive substance, it stays in your body for that period of time. And since the client is going to be admitted in the hospital, you are still going to be taking care of him or her. So, I hope you can still remember the principles of your STDs, with your shield time and your distance when taking care of a patient who is undergoing your radioactive therapy or your brachytherapy. Okay, apart from those principles of your STD, okay, I hope you can still remember, ha? Sana maalala nyo ito, shield time, distance. Okay? As protective measures of the staff or of the nurses in taking care of a client who is undergoing your radioactive therapy. So, apart from your STDs, you have to have your increased oral fluid intake. You need to void hourly kasi nga, nasa circulation mo yung radioactive products. So, you don't want it to be staying there for longer than what is necessary. So, kailangan mong tulungan yung sarili mong organs to excrete them out. Okay, there is a period of time that the radioactive dyes, or not the dyes, but the radioactive iodine stays in place. Okay? But naturally, it should not be longer than 8 to 12 hours. So, void hourly during first 8 to 12 hours. And then, you need to flush your toilet twice after use because again, whatever comes out of you, may it be your urine or your feces, kung siya, radioactive siya. Ayaw mong nang damay ng ibang tao. So, when you have this elimination of your urine and your feces, you need to flush your toilet twice after your use. Ensure thorough hand washing, yes, for protective measures, and avoid contact with children or even pregnant women. Avoid close, prolonged contact or sleeping with another person. No, that should not be the case. As much as possible, kung nasa hospital ka, you need to isolate yourself. Seriously, you need to do that because of your shield time and distance protocol. Okay? Consider this one as your brachytherapy. Okay, next. Client education on your radioactive therapy. If, for example, you're at home, it is important that you do not share dishes. You do not share your utensils, your food, or drink with another person. Avoid kissing and sexual contact until permitted kasi nga, ikaw ay radioactive. Huwag kang pasaway, makinig ka sa sinasabi ng doktor. You are radioactive. You don't want to share that radioactive blessings to other people because that's going to be causing more harm than good. Okay? Hospitalization, sabi ko nga kanina, if you're going to be hospitalized and you have your radioactive therapy, you will be isolated for several days, especially when there is large dose of administration of the substance to you. Clinical findings of hyperthyroidism, improvement of the client's case usually happens after 3 to 4 weeks pa. Okay? After 3 to 4 weeks pa. So, hindi siya one day and overnight treatment. It needs to be done for a period of time, and the result will take longer than 7 days. So that's 3 to 4 weeks. Okay? So those are your interventions for your radioactive therapy. So we have discussed your surgical interventions for your hyperthyroidism, and you also have your radioactive therapy for your hyperthyroidism. Now let's move on to your medications. I mentioned you have your medications, your anti-thyroid hormone medications, and if I can remember it correctly, nasabi ko din ito sa pharmacology ninyo, your PMS is your PTU, your metimazole, and your strong Lugol solution. It is an acronym. Ayan. And beta blockers. Ayan. Ito pala yung sinasabi ko na thyroid storm. Kapag sobrang, or your thyrotoxicosis, these are your manifestations that can be observed from a patient who has your thyroid storm or your thyrotoxicosis, the complication of an untreated and unmanaged hyperthyroidism. You have your high fever, you have your tachycardia. Alam mo yun, all to the roof, yung ating bilis ng system. So, you have your delirium. Instead of LOC changes only, you'll have your delirium, you'll have your chest pain, you have your dyspnea, palpitations, weight loss, diarrhea, abdominal pain, the severe case or worst case scenario for patients who have your hyperthyroidism. So, if you have a patient who has your thyroid storm, nakahandle na ako ng patient na may thyroid storm, as in kawawa siya, naka-cardiac monitor yung pasyente namin, and we provide your anti-arrhythmic medications every now and then. We have your IV fluids, we have your oxygenation, kasi pabagsak yung saturation niya. There's problems already. I think that patient was on mechanical ventilator during that time because there was your cardiac involvement already. Hypothermic measures, yes, we try to put blanket on the client. Steroids are also there to ease at least your inflammatory reaction caused by that increased levels of your T3 and your T4. Okay? Next, ito yung mga gamot natin. So, sabi ko diba kanina, PNS. So, P stands for Parathyroid. Okay, it's a medication. It's called your anti-thyroid medication, which is responsible for blocking the synthesis of your hormones. With your hyperthyroidism, you don't want the synthesis of hormones to happen because the more your hormones are going to be synthesized via with the help of your iodine, the more that your T3 and your T4 will be elevated in your system. So in order to block that step, you need to block your synthesis of your hormones, and your Parathyroid will actually do that for you. So your PTU, it comes in white tablets, which is very, very small. Ganun. Parang kasayos siya ng cetirizine, your antihistamines. Okay, very, very small. Next, you have your tapazole, or you have your metimazole. It also blocks your synthesis of your hormones. However, there are more problems with your side effects of your metimazole, one of which is your agranulocytosis. granulocytosis. Okay? So, ang ginagawa niya, binabagsak niya yung count ng ating, your granulocytes. Your granulocytes are very important in, because it's part of your, of your WBCs. It's part of your, your leukocytes. Okay, it's part of your leukocytes. So, without your granulocytes, not much of your WBCs will be produced. So, although your metimazole blocks your synthesis of your hormones, T3 and your T4, ang side effect noon, the disadvantage is that it causes you to have your agranulocytosis. And with agranulocytosis, what will result here is that you are going to have, okay, risk for your infection. So with this risk for infection that's gonna happen to you, alam mo yun, nasa thyroid storm ka na nga, tapos meron ka pang hyperthyroidism ka na nga. Tapos you are going to be dealing again with infection control measures, or maybe even a secondary infection. So this is quite dangerous for patients who are already compromised by their hormone levels. So your metimazole, I have not, siguro one time, it was given to our patient, but most likely, the maintenance medication that we provide to our patient is your propylthiouracil. It's your PTU, really. Okay? And besides, your PTU is actually a part of your crash cart in ICU. Kasama po yan. Okay? Emergency medication cart. You have that one there. You also have your sodium iodide or your strong Lugol solution. This is to suppress the release of your thyroid hormone. So, ang goal talaga ng anti-thyroid medications natin is to stop the release or excretion or circulation of your thyroid hormones. So you also have another one, your SSKI, your saturated solution of your potassium chloride. This is responsible for the suppression of the release of your hormones and will also decrease the vascularity of your thyroid gland. Kasi nga, hyperactive si thyroid gland kapag meron kang hyperthyroidism, di ba? So, you try to keep your SSKI so that it decreases, at least slow down the very function of your thyroid gland. However, the disadvantage is that it can stain your teeth. Para siyang iron, di ba? Kapag may iron supplement or meron kang ininom na iron, it rather stains your teeth. Okay. So, next, we have your steroids. Ayan, dexamethasone. Kasi nga, with your hyperthyroidism, there is a possibility for your thyroiditis, and there's an inflammatory reaction on your thyroid gland. So, what can we do about that? We need to provide your anti-inflammatory medications. Okay, provide your anti-inflammatory medications to suppress your release of your thyroid hormones. And last but not the least, you have your beta blockers. Your propranolol is a beta blocker. And if it is given in high doses for patients who have your hyperthyroidism, what does it do? Apart from the fact that it decreases your BP or your blood pressure, it also slows down or actually decreases the level of your T3 concentrations. Okay? So, kailangan natin ibagsak talaga ang T3 and your T4 natin. So, we have your T3 decrease via your propranolol, and at the same time, it also inhibits the thyroid hormone from converting T3 to your T4. So, one of the very important drugs, by the way, for your anti-thyroid medications is your propranolol. Okay? So, these are your anti-thyroid medications. I hope you can still remember everything. So, nursing management, for your nursing diagnosis, ito yung mga lumalabas na nursing diagnosis natin. And the needs also of our patient. So, reassurance related to emotional reactions experienced because apart from the fact that you have your exophthalmos going on for you, I mean, there is disturbed body image that's happening. You also need to be dealing with the emotional state of your patient who is experiencing these signs and symptoms. There might be need of your eye care because of your exophthalmos. So, seeing your ophthalmologist is also very important. Next is to regulate, or not regulate, but maintain normal body temperature. considering the fact that the patient is not able to tolerate your heat. Adequate calorie intake is important because you're losing weight here, and also managing potential complications such as your heart problems, your cardiac problems in the form of your dysrhythmia, your tachycardias, and your palpitations. So these are our nursing management for patients who have your hyperthyroidism. You also need to educate the client about the potential of your hypothyroidism. Kasi nga, ang side effect ng gamot na iinumin ng patient ng may hyperthyroidism is hypothyroidism. A client who has your hyperthyroidism needs to take your anti-thyroid medication. And if you overdose on it, or if there is over-ingestion of this anti-thyroid medication, you might end up experiencing hypothyroidism as a result of that anti-thyroid therapy. Yes, anti-thyroid therapy or treatment. So those are your nursing management for your thyroid problems. Okay, now let's move on to your hyperparathyroidism. So parathyroid gland na tayo. Your parathyroid gland is responsible for your calcium release, okay, and your calcitonin. So when you have your hyperparathyroidism, it is ang pabibo na parathyroid gland. As you can see in the picture you have there, your normal, you have four of those, four of those parathyroid gland. Okay? Kaya lang kapag meron kang hyperparathyroidism, you end up with, maybe one or two of these parathyroid gland which is hyperfunctioning and usually associated with your malignancy. That's your adenoma, your hypertrophy, or your hyperplasia of your glands. Ayan ang itsura ng ating hyperparathyroidism. And the result here is that it will increase the reabsorption of your calcium and excretion of your phosphorus in the kidneys. Dalawang electrolytes ang magiging problema mo when we're talking about your parathyroid gland is your calcium and your phosphorus. And I've mentioned this one in your fluid and electrolyte balance. Both of these two electrolytes have a love and hate relationship. If one is increased, the other one goes down. And if one goes down, the other one increases. So in the case of hyperparathyroidism, because there is a lot of your parathyroid hormone, you will think that there is a lot of your calcium, therefore, there is calcium elevation and phosphorus decrease. Okay, there is loss or there is less phosphorus. Kasi, ang nangyari dyan, nilalabas lahat ng kidneys mo, ang phosphorus mo, while reabsorbing your calcium all the more, which is not needed naman. There is just a certain level wherein calcium is acceptable. If you can still remember, yung ating serum level for calcium, which is normal, is 9 to 11 milligram per deciliter. Naalala? Okay, 9 to 11 mg per dl po. More than that one, well, you're suffering already from your hypercalcemia. And that is basically the problem with your hyperparathyroidism. Hypercalcemia. Reabsorption. Increased reabsorption of your calcium to the point that because there's too much of your calcium, na ilalabas lahat yung phosphorus sa kidneys natin. So, because there is your increased reabsorption of your calcium, what happens here is that there is demineralization of your bones, okay? Most especially if there's not enough of your dietary intake. That's going to happen. There is, a need. There is your normal need or a demand of your calcium in your system. Kaya lang, since masyadong madami yung calcium, inabsorb, yung ibang need niya, hindi na nami-meet. So, there is the mineralization of the bones that would likely happen because of that increased level of your, parathyroid hormone. Okay, so, assess for bone demineralization. Ang nangyari kasi dito, kasi merong masyadong mataas na bone deabsorption, some of these parts would have your calcification. Hindi siya equally distributed sa lahat ng bone parts mo. What happens is that they try to identify areas wherein they would have an increased levels of your calcium. And for that matter, some parts of your bone do not get enough Okay, only few parts. Yung few parts na yan, it's going to be abnormal pa. Such as in this case here, calcification. Makita mo talaga. Buti sana kung is distributed appropriately and proportionally to all. No, it's not. It's going to be, stuck and reabsorbed in this specific area only. And that's quite dangerous. Okay, ayan as you can see in this x-ray. Because why? You will have pain. And then since there is no actual proper distribution of your bone minerals in all bones or in all parts of your skeletal system, your patient is highly susceptible to your fractures, pathologic fractures. Kasi nga, itong mga area na ito, yun lang ang merong levels ng calcium na matino. Kasi yung iba, wala, kulang. Okay, pinunta doon sa areas na yan. Next, apart from that, you are going to be dealing with your hypercalcemia. Hypercalcemia, na nangyari dyan, mataas ang calcium level, and then bagsak si phosphorus level. Your calcium deposit can happen, hindi lang sa bones natin, wherein you have your bone pain, but it also can happen to other visceral organs such as your eyes. And imagine mo yan, yung mga bones natin, I mean, your minerals na dapat lang sa bones, napupunta doon sa ibang body tissues. So you have your eyes, you have your heart and lungs. You even also have your kidneys. Yes, that's where you have your calculi, your renal calculi. And that's a result of that very high level of your calcium in your system. You are also going to be subjected to have your cardiovascular changes. As you can see, these are your ventricular ventricular abnormalities in your ECG as a result of that hypercalcemia. So your patient will also be complaining about personality changes. You have your depression, you have your apathy, paranoia, talagang LOC changes, ibang-iba. So normal na personality ng patient. Patient will also be complaining about nausea, vomiting, anorexia, constipation. Polydipsia and polyuria, hypertension, cardiac dysrhythmias. Pinaka-delikado dito talaga ito. Yan. So, cardiac dysrhythmias. So, you can still remember yung mga, how your heart actually contracts with the entry of your calcium. Okay? Even your sodium-potassium pump, but your sodium-potassium pump is another thing. But you also have your calcium electrolytes coming in to facilitate your contractility. So, if there's too much of that, you will be expecting your cardiac dysrhythmias. You don't want cardiac dysrhythmias to happen to your patient because you will be subjected to having your heart attack or your cardiac arrest. Okay, next. We have, so, alam natin ang very reason kung bakit meron tayong, hyperparathyroidism. It's because of your parathyroid gland. Adenoma is one parathyroid tumor. So, ang intervention dyan, tanggalin mo. Okay? Restriction also of your dietary calcium intake. Bawasan mo yung calcium mo kasi nga masyadong madami yung calcium sa katawan mo. And next, furosemide. If there is so much of your calcium, kailangan mo siyang ilabas, di ba? Kasi nag-circulate lang yung calcium sa katawan mo. Hindi naman siya pumupunta doon sa mga bones natin, yung skeletal system. You're not there. Where do they go? They just flow in your circulation. So what do? You give them your diuretic, furosemide, your loop diuretic. So with your loop diuretic, it facilitates your excretion of your calcium out of your system. And yes, you have your calcitonin. You also have your gallium. These are calcium regulators. So this try to decrease, and from this suffix, tonin, diba? Tonin, calcitonin, calcium, tonin. So it tones down or tries to decrease the levels of your calcium. Calcitonin, kasi tinatone down niya yung calcium. So that's to decrease your calcium levels. Next, you also have your calcimimetic agents. Calcimimetic agents, mimic, it means to say it follows, okay, the body function of that calcium regulation. So with your quinacalcet or your sensipar, restricts your parathyroid gland into releasing less parathyroid hormones. Yan yung calcimimetic agents natin. Okay, so your sensipar. Next, we have your these are very, very common NCLEX questions. I even answered this one when I took the examination. So your alendronate. okay, or your Fosamax, or your Risendronate, or your Actonal, they are your biphosphonates. They prevent the loss of your calcium from the bones. Kasi nga, sobra, nag-demineralize ka na ng calcium eh. Sobra-sobra. Hindi naman kailangan, kaya lumabas sila. So, ang calcium natin, binabalik siya. It prevents the loss of your calcium from the bones. It tries to suppress the demineralization from actually happening. So, you have your alendronate and your risendronate to do that for you. Okay, biphosphonates. Next, considering that there is your bone mineralization, anong gagawin mo? I-assess mo yung patient mo sa renal calculi, your kidney stones. Kasi nga ayaw mong madagdagan yung problema ng pasyente natin. Your patient is already suffering from hypercalcemia. Not doing your job in assessment and checking your patient history would mean that you are one of those reasons why the patient will be suffering from your renal calculi and even your fractures. So please do your job in taking your patient history appropriately. Next, strain urine for your calculi and encourage your increase of your OFI. Assist the patient with your ambulation. Most especially with your biphosphonates. Kapag ang patient mo uminom ng Fosamax, kailangan po niyang gumalaw. Hindi po pwedeng nakaupo lang siya for a long period of time because that's going to be defeating the purpose of your biphosphonates. In order to prevent the loss of calcium from your bones, you need to have mobility. Okay, so assist the patient with your ambulation because when you do your weight-bearing exercises or when you do your ambulation or when you become mobile, it helps prevent the demineralization of your bones. You know, the very function of your biphosphonates is to stop demineralization from happening because it prevents the loss of your calcium from your skeletal system. So, in order for you to do that, you need to facilitate your movement for your patient. Exercise, yan, ganon. Okay, or maybe PROM. No, dapat kailangan mo weight-bearing. So, dapat maglakad po si pasyente. Okay? Next, monitor iron level. Yes, because you have problems with your electrolyte imbalances and your fluid imbalances. Next, avoid high-impact activities to prevent your fractures. Although I've mentioned that the patient needs to be mobile, pero huwag naman yung contact sports. Bawal po yan. Kasi nga, there is the problem of demineralization in your skeletal system. So, you don't want the fractures to happen with your high-impact activities. So, careful pa rin tayo dyan. Encourage foods with fibers to limit your constipation. So, high-fiber diet. Limit intake of foods high in calcium. Hyperparathyroidism na, diba? So, bawal yung mga milk products natin dito. Hindi po pwede dito kasi, again, it's just going to make the situation worse for the patient because he is already suffering from hypercalcemia. Provide cardiac monitoring. Ito, nasabi ko kanina, the patient that I've handled in the clinical area in the ICU who has your hyperparathyroidism or even your hyperthyroidism has your cardiac monitoring because we would like to avoid any cardiac involvement of the patient's case. Okay? So, those are our hyperparathyroidism. Now, let's move on to your hypoparathyroidism. So, it's the exact opposite of your hyperparathyroidism. Ang problema naman dito, ang problema dito is your low calcium level. If in your hyperparathyroid, your problem is high calcium or hypercalcemia. In your hypoparathyroidism, the problem here is your low calcium. Your low calcium level, insufficient amount of your parathormone or your parathyroid hormone is actually being released. Kasi, pinaka-reason, yung isa, sabi ko nga kapag meron kang total or maybe subtotal thyroidectomy, kasama na rin doon yung ating parathyroid hormone. Usually because of surgical intervention or maybe because of your radiation therapy. Yan, yung hyperparathyroid treatment option natin kanina for your radioactive, pwede din pong masama yung parathyroid glands natin because it is really situated on top. Not on top, at the back of your thyroid gland. So, kung anong problema ng thyroid, baka maaapektuhan din. There's a high possibility that there is an effect on your parathyroid hormones, parathyroid glands. So, what are the signs and symptoms that can be expected of your hypoparathyroidism? We have your tetany, yes. Okay, kasi nga, hypocalcemia, involuntary muscle traction. You have your Vostek, you have your Trousseau-sign. And you also have other symptoms, muscle cramps, your abdominal pain, perioral tingling, seizures. Basically, hypocalcemia problems. Okay? Ayan. There are also instances wherein, apart from having a decreased calcium level, you also have your, di ba sabi ko kanina, may love and hate relationship na electrolytes, especially when we're talking about your parathyroid hormone, is your calcium and your phosphorus. If in your hypercalcemia kanina, meron kang increase in your calcium and there's decrease in your phosphorus, in hypoparathyroidism, what can be expected is a decrease in your calcium, okay, and an increase in your potassium. Parang nagsiso lang yan, no? Yan. Siso. Yan. Ito, oh my gosh, wait for a while. You have your calcium, and this is your phosphorus, and this is your calcium, and that's your phosphorus. For increase, this is your hyperparathyroidism. Okay? Because hypercalcemia, right? And if you have low calcium, then this is your hypoparathyroidism. So, again, please look at this picture here. There's a seesaw effect. If one is increased, I mean, it's conversionally proportionate. Yan. Kapag mataas ang isa, bagsak ang isa. And vice versa. So, with your hyperparathyroidism, mataas si calcium, mababa si phosphorus. Kapag meron kang hypoparathyroidism, mababa si calcium, mataas si phosphorus. Okay? X-ray examination shows to you increased bone density in certain areas such as your spine. Ayan, sa likod lang siya. Okay? And you also have your cardiac dysrhythmias. I mean, any type of your calcium problems will also have your cardiac dysrhythmias. We also have here your cataract. Ito yung mga cataract because of your, your calcium, kulang ng calcium. Okay? Because of your lack in your calcium. So, if the disease is chronic, you might also be suffering from cardiac dysrhythmias, you might also be suffering from your alkalosis, and you might also be suffering from your cataracts. Ayan. Okay, next. What can we do for a patient who is suffering from hypoparathyroidism? Management and intervention would include, kasi kulang ka, di ba? Ano bang kulang sa hypo? Kulang ka ng calcium. Masyadong maraming phosphorus mo. So, to correct your calcium problems, you give your calcium gluconate, or maybe your calcium salts, or maybe even your vitamin D. Ayan. Let me put a square on that one. Ayan. So, you have your calcium chloride, calcium gluconate, IV for your emergency. By the way, kapag kulang ang ating calcium, and you're suffering already from your tetanic seizure as a result of that extreme hypocalcemia, your calcium gluconate or your calcium chloride comes in handy. These are your medical emergency drugs for those types of cases. So, ayan, nakikita ninyo, you have your calcium gluconate. If the client is already stable but still suffering from your hypocalcemia, then you can have your oral medications in the form of your calcium salts. Those are your calcium carbonate, calcium citrate. They sound familiar, right? Because they also are your antacids. Pare-pareho lang yan. Okay, and then next we have your vitamin D. Your vitamin D is very important in the absorption of your calcium in your system. And if you do not have your vitamin D, yung calcium mo, ikot-ikot lang siya sa circulation mo. So, apart from having your calcium supplements, you need to have your vitamin D to increase absorption of your calcium in your GI tract. Okay, it is very important. Most especially kapag meron kang mga dietary calcium intake, so vitamin D is very, very important. Kaya, kung ikaw ay mayroong calcium supplement everyday, dapat meron ka ding vitamin D supplements. It's very important. Okay? So, apart from that, parathyroid hormone injections should also be given to you kasi nga, that's what's missing from you, parathyroid hormone. And then you have to have your high calcium diet, but low phosphate diet. Your aluminum hydroxide is important. So, apart from your calcium salts, vitamin D, and your calcium gluconate, and even your parathyroid hormone injections, dapat meron ka ding aluminum hydroxide. Kasi nga, you need to do something about that excessive absorption of your phosphorus. So, makorek mo yung calcium, dapat meron kayong gawin para sa phosphorus mo. And that comes in the form of your aluminum hydroxide. So, that is to decrease your absorption of your phosphorus in your GI tract and just allow it to be excreted out through your feces. So, si aluminum hydroxide ang gagawa ng paraan dyan. Let me put a box to that one. There you go. Okay. Next. Apart from that, it's also important to observe your respiratory distress. Kasi nga, di ba, sabi ko nga kanina, your hypoparathyroidism usually is a result of your surgical intervention of your thyroidectomy. So, katulad ng interventions we have for thyroidectomy, you also have to observe for your respiratory distress because there are some instances wherein the complication of that is your hypocalcemia in the worst case scenarios. And apart from that also, you will have your edema, your tracheal edema. So, tracheostomy set plus your mechanical ventilator should be on standby. Prepare ka lang. Bawal kung hindi prepare dito. Ayan. Okay? Maintain seizure precautions and reduce your environmental stimuli. That is very important for our patient. Okay? And that ends our discussion. Tama ba? Bakit diabetes mellitus na dito? Okay. My apologies. Same. Hindi po siya diabetes mellitus. This is for still your hypoparathyroidism. Maintain seizure precautions and reduce your environmental stimuli for patients suffering from hypoparathyroidism. And that ends our discussion for your endocrine glands, thyroid, and parathyroid disorders. Okay, we will continue with your diabetes mellitus in another video recording. Thank you very much. I hope you're going to take down notes because this is a part of your quiz tomorrow. Okay, goodbye, class.